If you've wondered why your cycles feel off or why conception is taking longer than expected, maybe why your body is sending you mixed signals, your uterus and ovaries may be trying to tell you something. This is important because your uterus and ovaries are central to reproductive health. And when they're off, it can affect your ovulation, your cycle regularity, your embryo implantation, as well as pregnancy outcomes. So many women don't realize that those symptoms can be subtle. When we talk about fertility, a lot of times people immediately think about pregnancy tests and timing, but it goes a lot deeper than that. There are often things that are happening behind the scenes. The ovaries and the uterus are doing a lot that we don't know about in between times of ovulation and periods. And so we really need to look a bit deeper than that to find out what's happening and what may be causing problems with your conception. There are some key ovarian issues that are really good to look into, whether it's PCOS that could be present, there could be other ovulation problems, or ovarian cysts, which are different than polycystic ovaries. It could also be a diminished ovarian reserve, which you don't know unless you actually go in and have a check done, whether it's blood, but also a lot of times doing a more direct look or view scope to that area, just to find out what's happening there. The other aspect is hormonal imbalances affecting ovulation. So those are all key areas that sometimes don't get checked soon enough when you start wondering why you're not conceiving yet. There are some symptoms you really want to be aware of, whether you're having irregular cycles or missed periods altogether, or you're having really painful cycles each month, or even every other month. Good to know. The other things would be more acne that appears, could be there all the time, or could be showing up pre-period, or also things like excessive hair growth where you don't want it, not on the top of the head. And so you're looking for that kind of symptom. And then, as well as that, difficulty tracking your ovulation, because if you're having very irregular periods, then it's a lot harder to figure out when you're actually at your prime time to conceive. So those are some things. Also, you're having trouble conceiving in the first place. So maybe every month you think you know around the time you're ovulating, but you're just getting disappointed each month when it's a no on the conception. So those are a lot of things that are very much ovarian related. So you want to definitely look at those. If your periods are unpredictable, ovulation is hard to predict, or you've been told you may have cyst or hormonal imbalance, that doesn't automatically mean that the answer is simple. It often means the ovaries may need a closer look. If we're looking at the uterus as a possible factor, then we're thinking, is there fibroids present? Could there be polyps present? Is there problems with the lining building up enough for implantation to take place? Is there endometriosis that is present, which a scope doesn't usually do if you're just looking at the uterus alone, but it really requires looking more deeply into the abdominal area around the intestines, because a lot of times that's where there's different theories on what causes endometriosis, but if it's escaping, blood is going retrograde and going back into the uterine cavity, then a lot of times that is what is believed to be one possible cause with endometriosis. And so those little bits of material attached to different areas inside the abdominal wall, or maybe to the intestines, there's different areas they can find their way into. And it's one of those areas that is not always looked into as soon as, they're really trying to rule other things out first before doing a deeper dive like a laparoscopy. So, and that's where they actually have to do a little incision and go in and scope around to see where they might be finding endometrial tissue, and then they grab it and pull it right out while they're in there. But that's not the first step. So sometimes you may have that inflammatory process going on for quite a while before it's ever looked into. And having that kind of inflammation can impact whether you get pregnant or not, or stay pregnant. So it's a good one to look into if everything else along the way is kind of getting ruled out. So that's another one. The other could be like abnormal uterine lining or structural issues that can affect implantation. So those are things you do want to look into, especially if your journey in trying to conceive is taking longer than you anticipated. So we first talked about things that could be happening as far as ovulation, or what's happening with your ovaries, but also checking the uterus is really important. So I'd highly recommend that that's part of what you request or talk to your OB about having done. Some symptoms, though, can be things like heavy bleeding or severe cramps with your periods, or actually, you could be getting cramps even mid-cycle when your ovulation should be occurring. So that's something to also note to your doctor. Pelvic pressure could be happening, as well as spotting between periods. Your pain during intercourse could also be a factor that you'll want to mention. And then otherwise, unfortunately, reoccurrent miscarriages, which are heartbreaking, and no one wants to deal with that. And so, but there could be a reason that that's happening. So it's really good to investigate so, you minimize that risk. Other things could just be fertility struggles overall. So looking at both those areas is really important to do just to rule things out. I know sometimes the concern is whether you actually ovulated or not, which is a good thing to know. But sometimes it's not just about whether the egg was released or not, it's about whether the uterus itself and the lining is prepared for it. Because if you have an egg released, but your lining's not thick enough, or you have scar tissue, sometimes scar tissue can also happen if you've had other types of surgical help with removing lining in the past. So if that's the case, scar tissue will get in the way of good lining building up. And so when that egg comes down, it's looking for a good place to burrow into and start getting blood supply. And so if you have scar tissue, that's another thing that you want to look at and see if there's some things that can be done to help get rid of the scar tissue so you can have a better lining come in. And as long as there's some good areas there, it will usually try to find the egg. And so, but it's a good thing to rule out, is just check on that. So you want to know that your uterus can actually have that space, be able to have it implant into and hold the pregnancy, because having enough lining is really key. So you'll want to look at that because it is a major factor too. I'm a big believer in writing down questions that you have, things that you're worried about that may be irregular, because if you're having things like cycles that are consistently irregular, or if you're having heavy or extremely painful periods, or severe bloating or pelvic pain, those are important things to write down and make sure you're addressing with your doctor, especially if you're talking to your OB/GYN, so they know, okay, that could be a problem with this. And so you know what direction to go in. Some of the other things could be the repeated failed conception attempts that are being made, or a history of miscarriage. So want to check on that as well. And then lastly, if there are known cyst, fibroids, or endometriosis causing sudden changes in cycle patterns. So if it's already known that you have those things, you definitely want to make sure that you're tracking it, and you're being upfront with your doctor about what symptoms you're feeling at those times, because they are really, we'll say, telltale to what might be going on for you. This is why surface level advice isn't good enough. Fertility is not a one size fits all. Symptoms can point to different causes, and hormone issues, structural issues, and ovulation problems can all overlap. and treating only the symptoms often misses the root cause. So understanding the full picture really does matter. So that's why I was suggesting making sure you're writing everything down and really getting or giving your doctor a full picture of what all you're experiencing, because then learning about that can help figure out which tests are needed to be done to rule out certain possible problems, and then get to the heart of what actually does need to be worked on, because sometimes it runs deeper than you think. And when I say deeper, I mean it could be other problems that are going on in your body, not just your reproductive organs, because you have other glands that have to trigger your ovulation, trigger from up here, that it gets down there and says, okay, time to ovulate. Okay, time to build up this estrogen so lining is good for implantation to occur. There are a lot of different steps. And if you have inflammation going on internally, which I will be talking about in the next module or in the next YouTube video. And so you want to make sure that you are telling your doctor all the different symptoms you're experiencing, and make sure that a deeper dive may be needed to check other organ systems to make sure that you're converting hormones well, and that you're actually able to build a good endometrium for implantation, that your eggs are getting to their destination for actually being both inseminated as well as getting there for implantation. So those things are really important. And there is not always a quick fix when it comes to things of that depth. And unfortunately, it does call for some patience to be there, because you really do need to make sure that you're doing what's necessary to make sure that you can get to that finish line and everything works well and you can go through a nice, healthy pregnancy. So we will be talking about more topics along this way, just so you get a better idea of everything that you should be looking at, writing down, taking note of, and then sharing that with your doctor so that whatever tests are necessary to give you answers are answered. And so sometimes people feel like they can't tell they may feel uncomfortable talking about certain things or telling their doctor, but the more information you disclose, the better it's going to be for them, your doctor, to figure this out and be able to take next steps with you so that you can get pregnant and hold that pregnancy. Stay tuned. The next video, I'm talking about more how inflammation, infections, and even environmental toxins can impact fertility and staying pregnant. And so those are really important. And so if you will like and subscribe, you will be able to know exactly when that next video comes out. And I hope you will do that. So please like and subscribe.